Population, lifestyle, stress, genetics. A toxic social cocktail that has made India the diabetes capital of the world. More alarming is the many challenges diabetes patients face due to ignorance.
मुझे किसी ने बताया नहीं कि डायबिटीज कंट्रोल करना इतना जरूरी है. मुझे इन्फेक्शन हो गया.
I lost my toes due to infection. Today, the entire burden of caring for the patients is on the treating doctor, with limited or no support staff for educating and training patients.
There's a point that what we can provide in the hospital, what we can give in education at first go when the patient are never seen an insulin pen, it becomes almost very difficult to do it. And even if we are sure, we don't know what the patient is going to do it.
Understanding this very need, Sanofi, an integrated healthcare partner focused on patients' needs, launched a diabetes patients support program in India for Lantus patients. Sat Sat. Sat Sat was started in 2006 and is offered on behalf of the treating physician. Sat means together in Hindi, and 7 or Sat in Hindi represents the HbA1c goal for a diabetes patient. Sat Sat's objective is together as a team to keep the HbA1c level of the Lantus patient below 7% to prevent diabetes complications. Sat Sat is a 6 months long program. It empowers the patients for self-management to achieve a better quality of life. In the first visit, the Sat Sat counsellor enrolls the patient into the program as per his consent and his doctor's consent. He demonstrates the use of the Lantus device, how to rotate the injection site, and promises complete support in using the Lantus device. He then explains the importance of self-monitoring of blood glucose. Finally, the counsellor explains the concept of hypoglycemia management. The counsellor visits the patient again after a month. In this second visit, the counsellor first checks the insulin device, clears any doubts the patient might have regarding usage of the pen or injection site rotation, and reviews the patient's blood sugar log. The counsellor then does an in-depth counselling on diet, preparing a diet chart, and finally he explains the many ways to follow an exercise routine. In the third month, the counselling is done over phone. In the fourth month, the counsellor again visits the patient. He proceeds to train the patient on foot care, other diabetes-related complications, and even sick day management. The counsellor's effort is supported by well-designed booklets printed in many Indian languages. In the fifth and sixth month, the counselling is again done over phone. Sat Sat also has a call centre to support the enlisted patients across India. Presently, Sat Sat operates in 35 cities across India, with a team of over 78 certified counsellors consisting of dietitians, physiotherapists, psychologists, and professional social workers. All of Sat Sat's counsellors are trained at leading institutes on a regular basis on many topics like injection technique, pharmacovigilance, and others. Every month, the counsellor shares patient feedback with the doctor. The doctor's suggestions, in turn, are shared with the patient. Patient progress and adherence to regimen are monitored. A survey conducted by Sanofi to assess Sat Sat reveals that more than 75% of the doctors perceive the program to be beneficial in managing their diabetes patients. About 80 to 85% of the enrolled doctors perceive that most patient concerns are getting addressed.
Team Sat Sat plays as an excellent bridge between the clinician and the patients with diabetes on basal bolus insulin regime.
The survey also reveals that the majority of the enrolled patients perceive that Sat Sat helps them in meeting most of their needs for diabetes management, which gets translated in controlled blood sugar levels.
Amit from Sat Sat came over and explained the things like site rotation while giving the injections, the diet plan and other things. We also got call from the dietitian from Sat Sat. All this has helped us manage his diabetes in a much better way.
To date, over 200,000 patients have enrolled into the Sat Sat program, and Sat Sat has ensured most of them a better quality of life. Sat Sat has given hope and happiness to lakhs of diabetics and continues to make a positive impact on diabetes treatment in India. Sat Sat, we won't let diabetes get in the way of a healthy life.